This is Dr. Charles from NexGenEsis. This is phase 2 of knee stabilization. One of the key things that we focused on in phase 1 is that there should not be any weight on your knees as it's going through a range of motion as you're exercising. Well, what good are knees if you can't put weight on them, right? So phase 2 begins to gradually introduce load onto the knees as you are exercising. Please keep in mind, the exercises from phase 1 does not stop. This is an additional thing that you would add on to what you are currently doing. Stationary bike, okay? So it doesn't necessarily even have to be a bike. You can buy those, just the little pedals, right? That you can put on the floor, sit in a normal chair and just work it. But what is important is that you're able to change the resistance from the pedals, right? So the forces that come up from the pedals up onto your knees is less than your body weight. And so this is the phase before we do any body weight work. How you want to go about this is, let's say the resistance on that pedal or bike or whatever it is, it goes from 1 to 10, right? 10 being the heaviest load. You want to start, depending on where you're at and what you feel like is safe enough for you. I recommend starting at a 1, 2, maybe a 3. And also the duration should differ depending on where you're at. If you feel like a little hesitant about it, I would start maybe with 2.5 minutes. If you feel a little bit better, you want to start at 5 minutes. After your session, you always want to see how you feel the next day. Because you may feel good during it, you may feel good after it, but the next day you may really feel it inside the knee, the soreness inside the knee. I'm not talking about muscle soreness, that is a good thing. Knee soreness, however, is letting you know that the muscles are not strong enough yet to take the stress off the joint as it's being loaded, right? So if you feel soreness in the next day, I recommend ice down, focus on the strengthening a little bit more, and as you get stronger in these muscle groups, your ceiling will get higher and higher. Let's say you go 5 minutes, resistance 3, and you feel great the next day. Bump it up to 7.5 minutes. See how you feel the next day. 10 minutes, see how you feel the next day. Once you get to something like 15 minutes, depending on how easy this is for you, I mean, you can jump from 5 minutes to 10 minutes to 15 minutes, but something like 15 minutes and you feel great the next day, what you want to do is up the resistance from 3 to 4 or 5, depending on how it felt for you, and then you want to put yourself back to 5 minutes. See how you feel the next day. 7.5 or 10 minutes, 15 minutes, so on and so forth, right? Up the resistance, decrease the duration again. Now, there may come a point in time where you feel pretty good the next day, but in your mind, you're thinking, I don't know if I should do any more than what I did yesterday. If you feel that way, then you need to listen to that. Stay where you're at with the resistance and the duration, and continue with the strengthening. As the muscles get stronger, yes, you will be able to do more, but what is actually important is the stuff that we are doing here is allowing the joint to heal, right? We're putting it in a position where it can heal itself, which means the stronger the muscles are and the more it's able to take the stresses off the joint, the more healing that can take place. So continue with the strengthening phase 1, continue with the stationary bike phase 2 until you get to max resistance, and you can go 10, 15 minutes, you feel great, I'm ready for more. What's next? Comes phase 3.